LiveWell, Diabetic Footwear for the Visually Impaired, presented by Shirley and Mick Mitchell of Sutton Vision on the 13th of June 2024. About LiveWell. LiveWell is a series of events aimed at helping people make the most of life with sight loss. LiveWell is a collaborative project between 6 local independent sight societies. Sight Advice South Lakes, Cumbria, My Sight, Nottingham, Sight Airedale, the Airedale area, North and West Yorkshire, Support for Sight, Mid and West Essex, Sutton Vision, the London Borough of Sutton, and Outlookers, Huddersfield, West Yorkshire.
Right, good morning everybody. Welcome to this month's session. My name's Vicky from Sutton Vision. I'm delighted to have Shirley and Mick, who are members of Sutton Vision, who've been on before talking about diabetes and eye health and diet. And today they're going to be talking about foot care, which has me surprisingly excited because I've not seen my feet for 25 years. So over to you two.
Okay.
Good morning.
Good
We've
morning,
been
everybody.
introduced, as you say. Yes, we work alongside and we are also users of Sutton Vision, but we also belong to Diabetes UK. It's been quite popular lately for us to do a talk about feet. I don't know whether people are finding their feet and not in use or whatever, but we've been very busy. We've been working with Age UK and one or two other organisations talking about feet. But this is different because people with VI, it's not as easy to have do all the things that we would ask you to do. And this is what we're going to have a look at today. What is important? How can
I interject here? Although there's two of us here, Shirley will be doing most of the talking, as two people can't be talking at the same time.
No. Both of us have vision problems ourselves, and both of us have got feet. Now, you've all got feet.
Hopefully.
Yes. But it's the one thing we can't do without. I mean, you know, if you get problems with your car or your tyres or whoever it is, these can be changed, but we can't change our feet. So we've got to look after them. And how do we do this? Well, if you're lucky enough to have another person within your household, they may be able to help you, or you may have a carer or somebody that would be close enough to have a look at your feet for you. But we can't always say that. And if not, you're going to have to spend a lot of time on how do your feet feel. And that can be a real problem, because what are we talking about here? Now, one of the biggest things today is neuropathy, which means that for feet and diabetes, that can mean that you have no feeling or you have other strange types of link here. So we'll have a look at some of these which you might be able to link to, or you understand them. It could be a tingling sensation. You might feel pins and needles in your feet. It could be pain. It could be burning. It's something, if someone can, check your colour. Are your feet white? Are they red? Are they blue? Are they hot? Are they cold? Are they cold at certain times? Are they hot at certain times? Do you find certain things can trigger off your feet so they feel as though they're burning? Give you an example. I've had quite a lot of problems with my feet, and we'll explain a little bit about that later. But when Michael's had quite a few sessions in hospital, when I've been in there, because it is so hot, it doesn't help my feet at all. So they burn and burn and burn. But I've been able to work that out. And that's the thing. People think, oh, well, they're hot, so it's hot area. But that might not be. Is there some other reason that's causing this? They might change in shape. And you might find this when you're walking, or suddenly your shoes don't fit very well. We had a gentleman that we used to support, and suddenly he felt his feet weren't very well in his shoes very well. And unfortunately, yes, his feet had changed and the shape had changed. And really, if he had gone and had them checked out earlier, he might have been able to have saved some of his feet and toes.
He lost a leg.
Yes, unfortunately, he wasn't a good diabetic.
No, he wasn't a good keeper.
No. But what are we looking for? If somebody can check it, they're looking for, is there likely to be a blister? Is there any sore areas? Now, yesterday, we were lucky enough to have our podiatrist. She comes into our house, and she found something on Michael's foot that she's a little bit concerned about. So that was fine. Michael couldn't see that. I can see it because I've got some vision, but I couldn't see quite as well. But she did. So she picked that up quite early, and she's going to be able to treat it. Is there a cut on, if you cut your foot, or like anywhere else with diabetes, it takes longer to heal. And feet can be very nasty, sweaty, dirty. So really, the thing is keeping them clean. I'm sure those of you that are diabetic know that you have your feet checked once a year.
Should do.
With your check. But really, you must push the fact that you are BI and make sure that they do it more than once a year. You really need to have it done every half year or even every 3 months or so, just to keep an eye on them, because unless you ask for this, it doesn't seem to happen. We hear this more and more. You've got to push. But it should just be done by one of the nurses, diabetic nurse. They can do that. They don't even have to be the diabetic nurse for you. They can check your feet for you. Ask to see if you are worried. I personally had to push because I was having quite a bit of trouble with my feet, and I actually saw the community podiatrist. It took me a little while to get onto it, and you might find that a lot of people don't realise this is a service that is out there for people. But you think, oh, well, I'll go to my doctor. But you really need to push for this. Find out what you've got in your area for your feet. Can I go there?
They can be very reluctant to let you in.
Yeah, that it's so important that if you can't, can we get into this area health care service? We're very lucky. We have a separate one too. Although it's run by the NHS, ours is called the Sutton and Team Healthcare Service. And once you seem to be in there, you can get on and get your feet checked, which is absolutely great. They can look at your feet. They can suggest stuff. I was able to have something made to go into my shoes. So, these sort of things are there, which our doctor couldn't have done at all. But I really, really had to push, didn't I?
Yes, absolutely.
So, you really, what it's like having this sort of hidden disability. I think people don't realise that there's other things that need to be looked at as well. But when you go for your check, what are you looking for? Well, the biggest thing is that you have your socks, your pop socks, or whatever you might have on your feet taken off. We hear so many people say, oh, I had my check done, and they did it with my socks on. And
Impossible.
You think, they can't do that.
Impossible.
It mustn't do that. They need to be able to see what your feet are and what they look for. Now, you may not realise that, there's some sort of test going on. You may not be able to see what they're doing, but they should use something which is called a monofilament. And it is a little plastic, it looks very much like a stick, and it's got little fibres at the end. and they gradually work through your toes and areas of your feet, just pricking. And they'll say, can you feel that? And you go, yes, no, yes, no. And that gives them an idea of how the foot is, how the circulation is reaching, how the nervous system is working. And what we do impress upon people, if you have a little bit of sight, you can see, then please don't watch what they're doing, because otherwise you're not going to get a true reading. I mean, usually she'll say to me, shut your eyes. Okay, if Mick did it, he couldn't see them at all. But if I do it, then I have to, I usually have to shut my eyes and get on with it. They should check your pulses. Now, this will be done by a machine. They will have a machine that will hear your pulses. They put it on certain areas, and it should be from your knee down to your toes. So they will listen for the pulses. If they don't have a machine, they might use their hands and feel for it. But what they're doing is they're seeing how the pulse, how your blood flows through down to your feet. And it could be the hands, but make sure that they do that. So many places just do the pricking, and then they say, oh yeah, that seems okay. No, it's not.
Pulses are very
Pulses, we need to know how far does it go down. They may look at your shoes to ensure that you walk properly, or is it?
Or your shoes are proper.
Yes.
Shoes.
Yes. Or are they rubbing? They may give you ideas of what they feel might be better for you to wear on your feet. You know, some of us probably think, yes, some of these fashion things are a very good idea, but before you realise, one of the new things at the moment are the clogs. Well, we're finding a lot of people are coming back to us. I've spoken to 2 people recently who've had problems with them because they're not built as a shoe as we know it. They might be ideal, but if you've got diabetes, they're not too good on the old toes and what have you. So be careful if you think about something like that. They can also arrange further treatment for you. So if you do it with your nurse and she's not happy, she can get you then into what might be the link with your doctor's surgery. So in our case here, we would go to see the podiatrist in one of the areas. So that might be under the doctor's supervision, and they then can have a look and give you ideas and help you get that foot right. I've lived with a family of diabetes people, and my mum used to go, and she used to go to the local hospital, and they kept a really good eye on her feet because she had lots of problems, didn't she?
But so, she was a very, very active lady.
Yes, and it means really feet. If you can't, it means you're very limited to what you're going to be able to do. The biggest thing they should do is have sent you, before you have your yearly check at least, to have your blood sugars checked, which is your HbA1c check. And that has taken, and they look at your blood sugars over the last 3 months. And they will then perhaps decide with you whether that needs to be looked at or whether you need some sort of help there from the nurse or from the diabetic unit or wherever it might be that you're dealt with. And it is important that they know what it is. How can you help yourself? I mean, the other thing that you might find is if you're having trouble with your feet and you're diabetic, it's like any other problem that you get. If you have any difficulty with anything, you go and they say, oh yes, it's probably this, or yes, oh, it's to do with this. But I found that in actual fact, my foot problem wasn't anything to do with my diabetes. My problem, they found, is to do with a very low B12
vitamin deficiency.
Yeah, vitamin deficiency, which was causing me exactly the same complications that you have with diabetic neuropathy. And I again, because she kept saying to me, but your blood sugars are all right. I said, well, that's really good. And then she sent me for another blood check to have it done, and found that I had very low B12. And really, to me, that is one of the biggest things. What happens is, if you're taking metformin, which a lot of people are doing, metformin can break down the way we can save B12 in our bodies. And that is one of the biggest areas that they're looking at the moment. And a lot of people are being changed from a new type of metformin that's coming in. I've had it for about 8 months now.
Yes.
And I must say, it has been a lot better. My feet are a lot better. And I'm also taking B12 tablets. I started off by having injections and then followed it through. So I was quite glad that I thought, it doesn't always have to be your diabetes that's causing these problems. So looking at thing, I mean, it got so bad that I could hardly walk. My feet were burning. They were so I wasn't sleeping because they at night they would burn. I'd have to get out and put cold sorts of remedies on my feet. But now, thank goodness, with a little bit of pushing, and we all know if you're VI, you need to push, how important this could be to you. But how can you how can you help yourself? Now, you can keep your feet clean. When you wash your feet, make sure you dry them properly.
Between the toes.
Yeah. Make sure you're drying between your toes. Sometimes it's a good idea to, if you find it difficult to put your feet up, try standing on a towel. Rub your feet on the towel to get them dry. Try whatever suits you for footing. It may not be as easy as just, oh yes, put your foot up and dry it, but do try and keep it dry. Never, ever use any creams between your toes, because that can start the moisture, can cause a problem.
Fungal problem.
Yes, but do use cream. Do use any nice body lotion, something that is good thing. But the best one is this one. I'll show you.
It's CCS.
CCS?
And you can get it in supermarkets, in Tesco's, etc. They keep it, but it's quite expensive in a supermarket. So in actual fact, I buy it on eBay, and it's considerably cheaper.
It is
it's worth shopping around.
It's what the professionals use, but
CCS is absolutely superb. It's lovely.
We found within weeks it really, really helped. At first we used it daily, and then gradually as and when. The thing is that the skin absorbs it, and it doesn't lose it. Where with the others, if you tend to wash them again, it washes off. But that's fantastic. So try keeping your blood levels stable, and that's not easy. We've talked about diabetes itself to you, but the biggest problem with diabetes and feet is that when we eat something that probably got a lot of sugars in, we think, oh yeah, we'll have to be all right. But what happens when it gets down to the feet, it says, oh, there's a nice space down here. I'll leave some of the sugars here. And then it comes back again.
Behind.
It's all to do with our circulation. We forget, oh, well, I can knock it off. But sometimes, if our circulation is as good as it should be, we're going to lose some of it, and it stays in the feet. So really looking after your feet, find out what might trigger something off. Some people say, I can't eat bananas because I always find it leaves me with sugar, or it upsets my feet, or some things like that. I can eat bananas. My mum couldn't. My mum was a diabetic for many, many years, but oh dear, that used to upset her. I can't drink Coke.
Any sort of Coke.
Any sort of Coke, whatever it's got in it, I know it'll go straight to my feet. So, you know, we practice in what we know, and it can help you. It really can. No toasting your feet in front of fire. The things that came up when we were talking to quite some senior ladies the other day. And she said, oh, it's lovely, I've got a fire back, a real fire. And I said, and what do you do? She said, oh, I put my feet in front of the fire. And I said, no,
That's
please
the worst
don't.
thing she
Because
could do.
if you haven't got 100% feeling there, it's going to be, you know, before you know, you're thinking, what's that singeing smell? So don't do it. Try not to go barefoot unless you can, because it is so easy to pick something up. That friend we told you about, who unfortunately had bad thing, how he first found out about his diabetes was that he'd walked and he had a nail in his foot and he had no idea it was there.
Now, the problem with it is that he's the same height as Bernard Breslaw was, 6'7.5". Very tall man, so it's a long way to get down to your feet to actually examine them if you can.
The other thing is, don't cut your own nails. If you can get somebody to cut them for you, you might be lucky enough to have a lovely member in your family that might do them. If not, try and find out where you can get your nails cut. Not an expensive, don't go to an expensive place. There's lots of people out there. We have one now that we're using with links from our macular group, a young lady that comes to people's homes. It is, if you can find out somewhere that will do them, you might talk to somebody else at another group. You might ask at your GP centre, do they know somebody that does it? Have a check online. I have a friend who's not diabetic, but she's in a wheelchair, and I was able to find a gentleman that would come. The lady we can either go to her home or she comes to us, and she comes to us, which is lovely. Very reasonable, much, much cheaper than if we went to a shop. You may find that you live in an area where there's a group. When we talk to Age UK, they usually have somebody that comes into their premises and they do it at a much cheaper rate than you would, because nails are so important that you keep them trimmed. Don't use any corn plasters because they can burn your skin, or any of that paint that you can buy that says, oh, get rid of corns. That's no good. Again, you can use the corn pads that you buy to take the pressure off. That's fine, but you would need to get it checked out. Don't try and do it yourself.
No,
because that can cause quite a considerable amount of burning and pain, etc. One of the areas that has come up many, many times with us, people say, oh, my socks are tight, my socks hurt. Now, okay, you see them advertised, diabetic socks. Oh, yes, you can buy diabetic socks, but they're very, very expensive.
and aren't necessary.
No, you can get some really, really nice, soft, what we call soft top socks for ladies and for gentlemen. And they do soft top pop socks so that they're not too tight. They're ideal. You don't need to spend lots of money on them. You can, if you like posh socks and stripy socks, they do.
Oh, yes.
You can get them online. You can get them in the stores. Lots of places have them. And they're about a third of the price that they want for diabetic socks. Some people like bamboo. You can get bamboo socks that they help as well, but you don't really need to have expensive ones. The other way that you can help yourself is if they feel tight on your legs, turn the tops over so that you haven't got a ridge. So it helps. If you like walking, wear 2 pairs of socks. Then the movement, it's not on your foot, it's on the sock, so that your 2 socks are moving. So
not your feet.
Yes, and not your feet. So, these sort of things can really help. the other thing that some people find which does help, turn your socks inside out or your pop socks inside out, so that the ridge that's at the top of the socks, across the toes, is on the outside. It doesn't push down. And if you honestly, the honest thing here is, if you think there's something wrong, then for goodness sake, check it out, because, you know, you've got quite a big problem here. If it starts with diabetes, it takes such a long time to sort it out. You know, I think a big sort of link that I found that was so important was not knowing anything about what effect metformin had on your B12, because lots of people take it for such a long time. It's the cheapest drug for diabetes, and it's important that we know the full facts and figures, that it could be something else that's bothering you. Yes. So have any of you got any questions you'd like to ask us?
LiveWell and Future Vision. We hope you have enjoyed this presentation. LiveWell events take place on the second Thursday of each month at 10 AM. Future Vision sessions take place on the fourth Thursday of each month at 10 AM. And a technology event aimed at people living with sight loss. To attend the next session or to suggest future topics, please contact your local sight society, who will be able to provide you with the Zoom link.